glad to have with me eminent personality Dr. Gorakh Mandrukar sir. Sir is from Islampur. Sir is the chairperson medical disorders in pregnancy, boxing 2016-18. So welcome to the show, sir.
Thank you.
So sir, based on your recent ESUG 2018, which was on hypothyroidism in pregnancy. So you have seen so many patients of hypothyroidism or everyone. So what is the impact of hypothyroidism on pregnancy?
Right. Actually, once we see what is the primary hypothyroidism in pregnancy, it is the elevated thyroid stimulating hormone, and that is mainly the hypothyroidism in pregnancy. Then again, it can be subclinical hypothyroidism or it can be overt hypothyroidism. So if the FT4, the free T4 hormone is increased, then it is called as overt hypothyroidism. And when only TSH is elevated, up to say from more than 2.5 to 10, then it is called as subclinical hypothyroidism. And when TSH is more than 10, irrespective of increase in the free T4 hormone, still it is called as overt hypothyroidism. When we see the impact of hypothyroidism in pregnancy, we have to see mainly the maternal as well as the neonatal effects. When we see the maternal effects, then miscarriages, early pregnancy, recurrent pregnancy loss, anemia, preeclampsia, gestational diabetes, abruption, postpartum hemorrhages. So they all are seen as an increased incidence of these in hypothyroid women. And when we see in the neonates, then in neonates definitely the preterm birth, then intrauterine growth restriction, then intrauterine death, even the problems related to neurocognitive development of the baby, cognitive, neurological and developmental problems. So definitely hypothyroidism, if it is untreated in pregnancy, definitely it has impact on both mother and the fetus.
So do we need to screen all the women so as to identify hypothyroidism and we can prevent?
Right. That is a very great question, that should we screen all the women for TSH, for hypothyroidism, as we screen all women for gestational diabetes? The answer is yes, but till date, all the guidelines or all the recommendations, they say that it is not done as a routine screening in pregnancy. It is not been recommended by any except the Indian Thyroid Society. Everybody has recommended that it should be the high risk screening approach. That means that there are particular women, they have given some 9 to 10 categories. Say for example, those who are residing in the area where there is iodine deficiency, or the obese women, or if there is a history of recurrent pregnancy loss, known case of type 1 diabetes, and many more. So likewise, if such high risks are there in women, then only they should be screened. But if we see all those high risks, then definitely almost all women, by some say a percentage of 1-2%, if we leave behind, all women, they fit into that. So per se, if anybody asks, as you ask, as per guidelines, I will say it should be high risk approach. But per se, from an Indian point of view, if you ask, and from the experience if you ask, definitely all women, they should be screened. Because we did a pilot study at our place, and we found that the textbook does say that the percentage of hypothyroidism in pregnancy is 8 to 10%. In many areas of the India, we have seen that it has gone beyond 20-22%. So definitely all women should be screened for hypothyroidism.
So sir, what are the options available? Is it really challenging to manage such patients?
No, per se it is not a big challenge. Per se it is not a big challenge. We have to start the L-thyroxine hormone depending upon the level. There are levels which are given. Now newer guidelines say that the levels should be specific for that area. And say for example, in first trimester the TSH level should not be more than 2.5. Then in the second trimester onwards it should not be more than 3. And it should not be less than in all trimesters less than 0.5. So depending upon that, we have to adjust the dose of the L-thyroxine, say right from 25 microgram to as high as depending upon the levels of the TSH. take that L-thyroxine hormone early in the morning without taking a single drop of water, that means fasting. And if it is taken in a proper way, definitely the mother and the baby, they will get great effects. And we are talking about hypothyroidism in pregnancy. But for that matter, I will say thyroid disorders in pregnancy. Again, hyperthyroidism should also be screened. Though the management is simple and it is not much seen than hypothyroidism. Again, I have the hormone which has been seen, that is TSH and the free T4 hormone, they are the same. So yes, the women should be screened for thyroid disorders in pregnancy in India, and they should be treated as well as per the guidelines. As a chairman of medical disorders in pregnancy committee of the FOXI, we have come up with this chart which shows the management of the hypothyroidism in pregnancy, and here definitely we have given both the things, how to screen, then how to treat even in postpartum period. There are many problems when to stop those tablets and all. Everything is just a single page booklet, and definitely it will be a good guideline for and I congratulate MQR, though they do not have any single product in thyroid disorders in pregnancy, but as a role, they are definitely the great partners from the medical education point of view. You have called me here and you have discussed the hypothyroidism in pregnancy. That's great. I must congratulate you.
Thank you so much, sir. Thank you for sharing your views and particularly sharing your pilot study data. And definitely we look forward to you for managing such kind of patients. Thank you so much.
Thank you so much. So screen for thyroid disorders in pregnancy along with gestational diabetes, along with anemia and routine recommendations. Thank you. Every single life is very important.